So I'm so excited to have you here today. Just to introduce to all the moms, this is Danielle Kavonic from Mothers Embrace, and she's the first doula that I'm interviewing on my doula series to get everyone acquainted with local doulas in Johannesburg. I'm going to start there. So Danielle, do you want to introduce yourself and tell me a little bit more about yourself as a doula or as a mother? I know you're a mother of many children.
Thank you so much, Ashleigh. I'm really excited about this. I'm Danielle Kavonic. I'm a doula in the Johannesburg area. And basically, what drew me to becoming a doula was I personally had wonderful birthing experiences. And I could see the difference it made having supportive people in the room when you're having a baby. And I wanted to be able to give that same experience to other mothers. A birth can be an absolute euphoric experience. And I just wanted, to be able to pass on that knowledge that it doesn't have to be this scary, overwhelming thing, that it really can be absolutely sublime. And now that my children are a bit older, it enabled me to dash out in the middle of the night and do all those wonderful things. And really it's just, it's my absolute joy to get to know moms. I love working with people and I love working with couples and families. And it's really, it's a doula. It's a calling. It really is a calling. And I'm very excited about this initiative. But thank you.
It's a pleasure. Can you tell me a little bit? So before you became, you said becoming a mother was what helped you become a doula. How many children do you have, Kim?
I have 4 children. And
children.
I have 4 children at home and 1 baby in heaven. So, and that also, I know we'll talk about it a bit more, but going through that experience also affected a lot of ways in which I doula. So,
I'm sure it informs how you look after the mothers that are there.
Absolutely.
Good. So before, just to go back on how you became a doula, before you were a mother and before you were a doula, what were you doing?
So, it's quite amazing how things happen. So I'm married to a chiropractor, and ever since I got married, it's very useful. And I recommend chiropractic all the time, but I always do it. I always say, you don't have to use my husband. Just go for the chiro, because it's just it's absolutely so beneficial as a pregnant mom, as a postpartum mom, and for babies as well. So people always think, she's just biased, but it really, I recommend it so much because I've had first-hand experience of what it can do. But before we go off on a tangent, so I've been managing his practice ever since we got married, and through that, I kind of fell into medical administration. So I joined a small company called Dr. Billing when I was about 7 months pregnant with my second child. And, I've for the last 13 years, I've been managing all different medical practices: radiologists, gastroenterologists, rheumatologists, doing all the billing, doing invoicing and all the administration, and dealing with medical aid. And
which I'm sure gives you a whole different insight as well.
Absolutely.
Dealing with medical aid.
So, dealing with the patients, and it was just something that I actually became quite good at, even though I never in a million years imagined that I would land up doing something like this. It kind of just happened. And And our little business landed up closing down a few months ago. And, it was very sad. It was the absolute end of an era. I'd been with the same boss for 13 years. But it's really given me an opportunity now to just dive into the doula work. And I'm really using my time to just expand my knowledge and do as many courses as I possibly can, and to connect with as many people as I can in every way, so that I really can become, the absolute best that I can be at my job.
Oh, that's amazing. I love that you've got a little bit of a medical background as well, even at the administration side, because I know for me, in my third trimester, they handed you this pack. We're like, right, so this is the fees. You've got to make sure you've got these codes. And I was sitting there and I was like, got the worst mom brain, and I'm huge, I'm tired, I'm exhausted. It was hot because I gave birth in December. So my third trimester I was swollen, and I was trying to read these medical definitions. And it's part of pregnancy. It's you've got to actually do this. You've got to navigate the medical system wherever you birth, however you birth.
Absolutely. And that's, I see being a doula is such an all-encompassing thing. It's not only about giving you support during labor and birth. That, it can go right from, I know one of the questions that you're going to be asking is, at what stage should couples contact a doula or, get in touch with a doula? And, there isn't really a right answer, because, there's, I've supported couples where I kind of walk into the room, the mom's already in active labor. I say, hi, I'm Danielle, I'm going to be your doula. And then there'll be moms who phone me and say, Danielle, is this a positive pregnancy test? So it's really, and every time is the right time to have a doula. And part of what I do is to help you with all that. Like, you look at your medical aid thing and go, oh my gosh, like, what on earth am I supposed to do with this? Who am I supposed to phone? What codes am I supposed to get? What is a practice number? So, part of it is me saying, don't worry about it. I'll do it.
Or, very special skill to have.
Or just to say, no, all this means is that you've just got to phone the medical aid and literally tell them you're pregnant, and that's all that they really need, at that stage. So that they don't, kind of, hang on, who's this new dependent, this little person, and we didn't know that they were coming. And then you land up with a whole bunch of bureaucratic,
which is exactly what happened to us. I was in my pregnancy. They were like, you're not pregnant. You didn't tell us you're pregnant. We're not doing these tests. It's like, guys, you've been approving blood work and gynae appointments for months now. All of a sudden you say you don't know I'm pregnant. They're like, no, you didn't tell us.
They'll do anything to try and get out of it.
It's incredible, but that's a very special skill to have as a support person, because that's really what a doula is. It's a support person. And you're not just a support person for, like you said, for birth. It's for the whole journey. You've been a mother, you've been through the journey several times, but also you've seen all the different mothers and all the different stages, and you can really help someone navigate that, because we don't do it very often as moms.
Also, there's, for example, I've met a couple, that are, they're only at the time of their lives where they're thinking about falling pregnant. And her mother passed away when she was a teenager, and she doesn't have a mom to kind of go through the process with. She doesn't even have a gynae, and she doesn't know, which gynae must she go to? Like, must she go to a gynae who will be with her for her birth, or must she go to a gynae who, just for a checkup? She really needs that guidance. And it's, that's that's what made me so excited. I said, I'll be your mom.
That's so lovely.
But, really, sometimes it's just about, a doula is not a medical professional. We cannot perform medical procedures. We can't check blood pressure. We cannot check the position. We can't check how far dilated you are when you're in labor. But we have extensive knowledge on the physiology of pregnancy and birth. So we're kind of that bridge between the pregnant couple and your care provider, whether, you're with a midwife or you're with a gynae. So that we can kind of build you to a place where, you're not only supported, but you're also educated about what is coming, that, birth isn't just something that completely shell shocks you. So we're there to educate you so that when you do get to the birthing room, you've got that extra support, but you've also got the knowledge of what's happening to your body so that you can, best navigate your own labor.
No, I love that. And I love that, what you said is you're the bridge between the two, the parents and the provider, because, and I know it depends now. There's a whole other kettle of fish if you go midwife care or OB care. I'm not even going to open that can today. But some providers don't give you enough time to ask enough questions, or you might not see them for long enough to form a relationship, and they might actually not be present for most of your labor. So having someone there that is a bridge between that provider and their medical knowledge and what they bring to the table, and the couples who've never done this before and don't really know the difference between early and active and, transition and all these things, like they don't know any of this, have never done it before. So just have that person that holds your hand from the beginning, from those 2:00 in the morning. I don't know if this is contractions through to, oh my goodness, there's a human here, and even beyond that. It's definitely a bridge that is needed for the medical community and the regular parents.
Absolutely.
So I like that.
And also, a lot of moms might say, I had such a wonderful, supportive partner. Why do I need a doula? And it's very important to, I always tell my families that I'm not there to replace their partner, whether their partner is the father of the baby or their sister, a friend, their mother. Whoever their, primary partner is, that's going to be there with them in labor. I'm not there to replace that person. I'm there to also support that person, because sometimes, especially dads, they're also producing, hormones. They suddenly go into protective mode, and they see their wife, or, their partner, doubled over in absolute pain, making sounds that she's never made in all the years that he's known her. And it can be really scary. And he may look at her and think, no, there is something very wrong. And that's usually what pain tells us. If you have a throbbing tooth, that pain is telling you that there is something wrong with that tooth. That tooth is decayed, or it's impacted, or there's an infection. If you, twist your ankle, pain is telling you that you've done something to the ligaments in your ankle. But that contraction pain is positive pain. It's telling you that your body is working to bring your baby closer to you. But the dads are saying, no, there's something wrong. This is too much. This is not normal. And so your doula will look and say, she's actually doing so brilliantly. She, ran with that contraction like an absolute boss, and now tell her that she did. And, so your doula is there to just have that calming presence, because it can be hectic. It can be crazy. She can be screaming. She can be, completely out of control. And the doula is just there to try and maintain that calm for everyone, so that people don't start freaking out and demanding epidurals and medication.
Well, but I like that point, because one of my reasons that I pushed to get a doula at our birth was because I felt that my husband needed the support. And I thought, I'm busy. I'm not going to be able to support you. So we needed someone in the room that he had already had a relationship with to be like, look at him and be like, this is okay. This is good. This is like, she's not responding to you right now. She's busy in her little labor land, but this is good. You can do this. You can do that. You can also step out the room and take a breather for 5 minutes and come back. I think that was also, and it was so useful for him to have someone in the room for him as well. And that's one of the main reasons I had a doula. And I think moms, like you said, they get it confused. It's not a replacement person. It's a support for the whole system. Make sure the husband also eats.
Yeah, absolutely. In my, I do antenatal classes as well. And, part of my preparing for labor is that the dads have to have that and pajamas and toothbrush, and everyone's so focused on mom, which, absolutely we need to be focused on mom. But, the dad, just because he's not physically going through the same thing, it's still as much his baby as it is the mom's baby. And
still having a baby that day.
Usually, and so if mom's been, and laboring for 13 hours and she's hydrated and nourished, that's all very well and good. But if, her primary support is, absolutely out of it and he's nauseous because he hasn't eaten anything except maybe an energy bar that he pilfered from his wife's stash, that's, it's so important too. So, I always, our clients call me the hydration police. I'm constantly running around making sure that the mom and the dad have had something to drink and that they're eating. And, it's very important. And I get the dads involved because, they are the primary, resource for that woman's oxytocin. So that oxytocin is that love hormone is what is going to get that baby out. I'm not going to provide that oxytocin for that mother, although I have been told by many moms in labor, Danielle, I love you, don't leave me. But at the same time, that deep connection that they have with their partner, even with their mother, with their sister, whoever is in the room with them, they are the ones that are going to be helping that mom pump that oxytocin so she can create her own natural endorphins and painkillers. So I get the dads to do lots of massaging and dancing and just stroking her hair and, putting, a full damp face cloth on her face. And, just all of that helps her relax, keep her body relaxed, keep her mind in focus so that she creates that optimal environment to birth her baby.
I mean, that's brilliant. Also, another thing is the partner might not necessarily have been in a birthing room before. So you're there to be like, this is the next step, let's do that, and tell them how to help. Which is brilliant. I absolutely love that. And I love that the partner has been such a big talk because a lot of the moms that I speak to, they're like, but my husband's going to be there, or my sister's going to be there, or my mom's going to be there. So what's the point of having a doula? And I think we've covered that really well. It's been, I think that's really good. I just want to ask quickly, sorry, how did you study to become a doula? So a lot of people, I don't think they realize that there is studying involved. You touched on it before, and I think I don't even have it in my questions, but I was like, at the back of my head, I was like, oh, ding, ding, ding. This is a good one. A doula isn't a medical professional. And yes. I've had moms be like, oh, they can't even check this. What's the point of having them there? They're not a medical professional. They don't come with a Doppler machine. They don't like put the gloves on and, get involved in stuff. But what do you study, in order to become a doula?
So we do an intensive, course. So I did my doula course through an organization called Mama Bamba. It is run by a doula and who's also a midwife and counselor. Her name is Robin Sheldon. She's originally from Cape Town. She really is a pioneer when it comes to birthing and in connection with the unborn soul. She talked a lot about, parents connecting with their unborn babies before they're born. And I bring a lot of that into my doula work as well. Because that little baby is not a passive passenger. It's very much active in everything that is happening. So she's amazing, and she formulated the course together with a few other doulas in Cape Town and in Johannesburg. And because it was kind of still COVID time, I did the course online. And the benefit of that was that I got to meet women from all over Johannesburg, which was really special. And we would have an intensive workshop for about 8 weeks, where we would have live lectures. We had assignments that we had to hand in. There was a minimum amount of books that we had to read. Just to, if you don't understand the physiology of birth and, how the human body works, then you're not going to be a great support. Supporting a mother in labor is not just about holding her hand. It's about understanding, this is actually not an optimal position for her to be laboring in right now. It's causing her pain. It's actually preventing the baby from coming down. And so your doula just has that little bit of extra knowledge, not necessarily on par with a medical professional, but we have, as much of an understanding of how birth works. I've often been in a room with a midwife, and the mother will make a sound, and the two of us will look at each other, and we know that means that she's ready to push her baby out. And so, so it's, and that's the thing where, within the course as well, we do, there's constant education. We have unlimited resources that we have access to, and we do an extensive breastfeeding course as well, of which I've actually taken further. I have done
That's good.
several breastfeeding courses. I always considered myself an expert in breastfeeding because I breastfed for a total of 7 years with all my children. But I had never shown someone else how to do it. I just was able to do it myself. And so understanding also the physiology behind breastfeeding. So there really is, there's a lot that we go through and a lot that we learn. And, because, most of us are so passionate about what we do, we're constantly, looking for more things to, more courses to do, more research to do. And, to make us, completely comfortable in the birthing room, because, a lot of the time we come into situations where, the care provider may not be as comfortable in the birthing room as we would like them to be. And, I think, so, the doula revolution, is to just try and normalize birth, and to, just bring all of that knowledge, into the birthing room so that our moms can, have their births as it was intended to be.
I love that. So you guys study extensively, and I don't think many people realize this, but I've seen the Mama Bumper course. I've gone through the course curriculum, and it's a lot. It's a big, I was like, maybe I should do this. I was like, no, this is a really big commitment. It's a lot. And I just wanted to do it because I'm fascinated. Like I've got a little toddler, so I wouldn't be able to be a doula because it's just like you said, the middle of the night call outs and things. It's a commitment that only certain very special women are able to do, and their families support them. It's amazing. But it's a lot. The curriculum is a lot. You go through a lot, and every doula I've spoken to has said things like, I study further, I've done this, I've done that, because you're constantly learning, which is great. I love that you said you did breastfeeding, because not all doulas have the breastfeeding extra courses. Some doulas have more body work, some doulas have more spiritual stuff, but the breastfeeding is a nice one to have, because you're there after the birth, once that newborn's out, And so do you help the mothers latch and help them explain what's going on and kind of see that they're off to a good start on their breastfeeding journey?
Absolutely. So, I feel it is so important. My moms know that I will only leave them when they feel comfortable breastfeeding without me and latching their babies without. So, I can land up staying at least 2 hours after they've given birth to their babies, just to make sure that they, are comfortable with breastfeeding, because even if you've had children before and you have breastfed before, this baby has never done it. So even though you've done it, you've never done it with this baby. And every baby is so different, that, it was one of those things where, I had my third baby. I was the type of person who only stopped breastfeeding the child because I was pregnant with the next child. And so, it wasn't like, oh, I haven't done this in a while, I may need a bit of help. And then my third one, I just couldn't understand why I was in so much pain. And, so it was a learning curve, even for someone like me who breastfeeding just came so naturally to. So, it is such a vital thing to be able to, help those moms, and just to check, that even if they, researched it themselves and they understand, the mechanics of latching a baby, that they've just got that person to say, what, that is a fantastic latch. How does it feel? It's, because I also like to be able to eventually step out and let my family bond, without me hovering over them. And, that's, that breastfeeding, just to make sure that, because it can sometimes take time, and it's so good for moms to have someone to say, what, even though it's been an hour and we haven't managed to latch this baby, it's okay. They don't come out, starving. They may come out, with their hands in their fists and looking for a nipple, but it doesn't mean they're starving. They've actually been so well nourished by the mother's placenta that, you've got time. And then one of the things about, everyone talks about the golden hour, but I find some moms might, completely freak out. It's been an hour and I still haven't managed to latch my baby, but it really is okay, because you're both still learning. You're figuring each other out. And that's just such a beautiful thing to be able to breastfeed your baby, and also just to, give yourself a chance and give your body a chance. You may, try express something and nothing comes out, and some moms just say, well, I don't have anything. We're going to have to give formula. And sometimes all it takes is, is that beautiful initial first suck from baby to have, everything going. So, it's just, there's so many moms who just, they feel they can't do it, that if they've got one cheering them on, then they're so much more likely to, to keep going, persevering, because it's not easy. It's hard work, and it's hard work for baby as well, which is why it's so good for them. It's so good for their jaw and their tongues and their lips, and, so, but it's really just, it's something that you've just got to persevere with if that's what you want to do.
No, definitely. I think, there's a lot of this idea that I can't breastfeed because I haven't been able to, so I have to just jump into the formula train. And there's a lot of negativity coming from outside saying, oh, your baby's fussy, give them a bottle, your baby's da-da-da. So have someone there saying, you've got this. Look, this is okay. Look at this. This is great. It just helps the mom, because birth expands you. It blows you right open, which leaves a lot of cracks for stuff to come in. So when the new parents come and everyone's giving their comments, it gets in very quickly. It gets in very deep. So to have someone throwing good stuff in those cracks while the mom is busy sorting out herself and trying to figure out what's going on is so important, just to have that encouragement. Like you said, just saying, you're doing a good job. that looks amazing. Well done. It just, oh, okay, cool. It's not so bad. And I think that's really, that's another important thing with doulas. I remember I called mine, actually my husband called mine 3 days after I had that hormone dip. I was crying, the baby doesn't love me. Doula came running. She was in the house. She's like, this is okay. Let's talk about it. Da, 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 da. You know, and it was just even that afterwards, you know, like having someone for my husband to call because he was, I don't know what. It was someone that we could call that was not a family member, but someone who knew us, you know, to kind of just help us navigate that perfectly normal period after birth.
And that's what's so great about, you know, having that doula, because as you say, she's not a family member, but she's also, you know, you're not going to phone your gynae at 8 o'clock at night and say, you know,
my baby doesn't love me.
Or also, you know, you may not, like, you're not going to phone your gynae and say, no, my baby's head feels like it's sitting in my underwear. Is that okay? You know, and your doula, you know, is much more accessible. And that's also what I love about midwives, is that midwives also tend to be more accessible. And, you know, so that's, you know, for moms to consider, you know, unfortunately, moms tend to think that it's safer to birth with a doctor in a hospital, and it's not always necessarily the truth. You know, you you know, find this beautiful, wonderful midwife who has delivered thousands of babies and has literally seen it all. You know, she can be, you know, a wonderful resource to have. You know, just remember, you know, I had a TMI. I had bit with such bad hemorrhoids when I was pregnant. It was, you know, that was like the, you know, and it affected everything that I did. I could hardly walk. It was so painful. And my midwife said to me, put Vicks Vapor Rub on it. And I was, what? Vicks Vapor Rub? My had researched all these different creams and suppositories. None of them worked. And can I tell you, I put Vicks Vapor Rub on these things and they disappeared within 24 hours. I was like scared to push out my baby because I was worried I was going to like burst hemorrhoids. And I thought, I'm not going to be able to push out my baby. I mean, this is after having these, you know, beautiful water births, you know, and now I'm worried about hemorrhoids. And she said, put Vicks Vapor Rub on it. And, you know, it was literally the most life-saving thing. Just, you know, this, you know, that she's had so much experience with, you know, women coming in with all these funny little pregnancy ailments. And, so that was just, you know, such a wonderful thing. So yeah, so that's why also now you ask your
Vicks Vapor Rub. I never heard about that one.
Hemorrhoids. Put some Vicks Vapor Rub on.
Oh, that's amazing. I had bad hemorrhoids as well, and I used witch hazel. It didn't work as well as if everyone said it would. So and I never heard the Vicks one. So this is, you see, but this is also again a bounty of knowledge available by people who've been through it before, which is, that's incredible. I wish I'd known about the Vicks, because it affects everything, and no one tells you it's coming until it's suddenly there, and you're like, what is this thing? And then you Google it, and you're like, oh my God.
If you're running after
your baby's too big.
You know, and if you're pregnant and running after a toddler and you have hemorrhoids, I mean, that is just going to exacerbate the whole thing. And, you know, because your toddler is not going to let you lie on the couch for the last few weeks of your pregnancy. You know, you're going to be up and at 'em for literally until you go into labor. So, yeah, so having to run around with, you know, horrible hemorrhoids, you know, it's, you know, so all these little things, and, you know, and that also, you know, the pregnancy niggles, you know, Danielle, you know, I'm having such crazy heartburn. What can I do besides, you know, down Gaviscon all day? You know, the doulas, we've got tricks up our sleeves for most things. You know, it's not just, you know, as we said, it's not just about, you know, the labor and the birth. It's about before, and, and also even preconception. I have a lovely podcast, which I've done together with a doula colleague, Lisa Houghton, and with a midwife, Sharon Marseille, who's literally been in private practice for, I think, 30 years. And she is just a wellspring of knowledge. And we started our podcast right from conception and preconception. What should we be doing? It's not just about, and unfortunately a lot of the time, it happens like, oh, hang on, like I didn't get my period the other day, and then suddenly you're pregnant, but, did you prepare yourself? Did you prepare your body? And so,
first of all, I watched the first episode of your podcast. I'm going to link in wherever I can, because it was actually a brilliant summary of knowledge. Like, I really enjoyed, it was a nice, well-rounded amount of knowledge, which was great. But like you said, preconception, conception stuff, the only thing most people know about having babies is how not to have them until they decide to have them. And then like, it's easy. I just stop not wanting to have them. And then and it doesn't always work out that way, but the birth workers can help you prepare your mind, your body, your soul, and all that stuff, and help you navigate, like, what does it mean to fall pregnant and how do you actively do it as well, which is, so a whole other journey as well. This motherhood thing is just a bunch of little journeys to the end. I don't even know where it ends. I'm still in it. So, but that's really cool. So do you have people come to you prior to being pregnant and saying like, I want to get pregnant? And can you help them? Would you?
It's generally people, that know I'm a doula, and, or they've heard about me, and, or they may be experiencing, some infertility, or, they're not quite getting, they're like, well, I stopped my contraceptives. Why am I not getting pregnant? And, so it is nice to have, someone who's in the know, and to say, and to be able to recommend and refer on. Sometimes it's just about what and who it could be, that just, I came off the pill, but we're not falling pregnant. And sometimes it's just, that it could be that they need a checkup at the gynae, to make sure that, everything's in order. Or it could just be, lack of knowledge on how their body is working. It could be that you're ovulating at a whole different time that you think you're ovulating, and just becoming more familiar with your body, and understanding how things should work, so that you can say, what, hang on, I don't experience this in my cycle. I wonder if that means that I'm low on this hormone, or I may just need to, try, conceive a few days after, the certain point in my cycle. My cycle's not quite 28 days, so sometimes it's just nice to bounce these ideas off someone who has extensive knowledge on the subject, and it may very well be that you need to go and, investigate fertility. I personally had my own little infertility journey, and spent time at Vitalab, and went through, not necessarily IVF, but I went through, this journey. So, I also, my phone's falling out of my ears. I'm smiling so much, and so much I love talking about this. So it's just, and there are also, fertility counselors. There are people out there. When I was doing it, I just, my mother suggested I go to this specific doctor, because she had gone to him for her amniocentesis when she was pregnant with my brothers. And it was at a fertility clinic, so I just went there. There was, so sometimes it's just really nice to have someone, and people don't think of contacting a doula for that kind of thing. They think, well, I must just go to the gynae or just go and, and sometimes the doula may just, recommend something that, would save you from, I had a client who, her baby was about 7 weeks old, and she had been breastfeeding beautifully, and she just came into a bit of a rut where she wasn't drinking as much, and she was just crying all the time. And she said, no, I think I need to call in a lactation consultant. And it was on the weekend, and she couldn't really get anyone. So I suggested something. I said to her, start the feed, because she was also feeding like directly on the clock. And by that time, her baby was crying. And I said to her, try and start your feed a little bit earlier before baby starts getting hungry. Like, even if baby's not, starving or hungry. She said that this baby chugged a double feed, just because.
Baby was so hungry. So hungry.
And because she had latched the baby before this baby became hysterical. And that's all it really took, and she didn't have to call in a lactation consultant, and now she knows crying is a late hunger cue. We don't try and stuff our boobs in baby's mouth when they're screaming and crying. And, they're like, how would you like if someone shoved a hamburger in your mouth while you were crying?
Yeah.
So that's, and it's such a small thing, if you think about it, but, it's just being able to step back because, as a mommy, if you've got this hungry, crying baby, you're not going to be, thinking laterally and logically. Sometimes all it takes is someone to say, just feed your baby a few minutes earlier, or, just feeding baby at that time. So yes, even the fertility journey, it's great to have someone to bounce ideas off, and someone accessible like a doula, someone you can WhatsApp, like a friend, because, those busy guys, it's not going to happen like that.
But there's also two things, because also some people don't want to tell their family members that they're on that journey, because that it gets emotionally invested, and they want to find out, are you ready? Are you having, what about this month? What's going on? So it's also nice, like I said earlier, to talk to someone not family. And then a local doula will have local recommendations. So Dr. Google is all great and all wonderful and all fantastic, but a doula that's in your neighborhood or in your area or something will know doctors, lactation consultants, chiropractors, fertility clinics, tricks and tips and stuff that are locally available for a mom to do, which is also amazing. There's so many of these online doulas you can get in America and Australia and things like that, and they have a wealth of knowledge, but they don't have knowledge for us here where we are. I know my doula, I had the beginnings of mastitis. I was like, I think this is the beginnings of it. It's hard, it's sore, latched it. Before it even became something, she had me contact the person to get, and they couriered these little herbal things to me. Within 3 hours, I was all good, and I didn't have to go through that process of, I don't know if it's happening. I have to go to the doctor, make an appointment. Again, it was the weekend, make an appointment. Now it's already worse because I haven't done anything, and then I have to go on it. But, it was a much quicker turnaround time, a much quicker response, because it was, this is a solution. I know what's going on. And it's a local solution. And that for me is a huge thing. In South Africa, we need a lot more local communities to come together, because we have amazing providers. But no one's referring anyone because no one's looking. That's co.za.
Yeah. And I was about to, when I, so funny you said .co.za, because that domain wasn't available when I was creating my website. So I didn't even manage to get .com. Ashleigh, I love that you said that. And one of the things that I provide our families, when they take my services on is I give them, a parent guide, and in the guide, it's about me, what I do, but also, a whole list of resources that they might need to use while they're pregnant, and after they've had their baby. And what I've tried to do is add resources that I've either had personal experience with. So then I can say, that this reflexologist is absolutely amazing. Or, this, want to learn baby massage, you must go here. If you have a baby with special needs, this is where you should start your therapies and that kind of thing. And so I think it's so important, as you said, to instead of, like going online, Sharon, the midwife who I do the podcast with, calls it the Google machine. She's not a fan. So I think it's so important to have all of that information at your fingertips that you can give to parents, and so that they know, I don't want to spend money on a breast pump, but I have to pump. I'm going back to work. I don't know what to do. Maybe I should just call your doula, and doula will say, oh, look, I have, you can rent a breast pump, so you're not forking out all of this money and your medical aid is finished, and, so you can hire a breast pump. And, sometimes, moms just don't know. And
that's exactly it. It's available, but there's no way they don't know. And they're struggling with something that they shouldn't be struggling with.
Absolutely.
Yeah. Oh, that's amazing. I've loved chatting to you today. I think we got through everything without even me looking at my notes. I'm just going to quickly double check. Okay, I have one. This is my favorite question. We didn't cover it all, but let me just quickly. Okay, yeah, I just want to hear what your ideal birthing situation is.
Oh, wow. Gosh.
This is a personal one. If anyone's watching, just quickly, this is not a recommendation. This is not like, this is how you should birth. This is a personal thing. I want to know what your ideal situation is. You said you had 2 amazing births. So.
Yeah. So although I was induced with 2 of my births, and induction is not a joke. Induction can be very painful, and especially for a first-time mommy. And unfortunately, a lot of people, even medical professionals, say, no, once you're induced, it's the first step towards having a Caesar. And it really doesn't have to be. And that's
it's a unique individual thing, I think. It depends on, 100% depends on the mom and the baby. Like you said, what's going on as that teamwork.
Absolutely. Yeah. And so, I've had inductions where, the mom was just absolutely not coping, and she, and then as a result, baby was not coping. And so, to just be safe for mom and baby, a Caesar was necessary. But then I've had others where the moms just listen to their doulas. And also, as I said, I have lots of lovely tricks up my sleeve, and, to help, the moms get through that. And I was very fortunate. My team of midwives were like doulas. They never left my side. And even having a midwife, not all midwives will stay with you for the entire duration of your labor. And mine did. And, I didn't even know what a doula was when I was having children. So, that's the thing, to have someone. So my ideal was, my bookends, my first and my fourth, I was induced with both of them. obviously being induced with the first baby and a fourth baby is very different. I ended up having the most magical birth with my daughter. An amazing image of her floating into the world. It was beautiful, but it was hectic. It was painful. And my middle two, I went to labor completely naturally. And it was just this incredible, feeling of that my baby is ready and my body is just doing exactly what it needs to do. And it was like the seesaw effect of the contractions slowly building and, just managing labor at home until I felt that I needed to go into the birth center and meeting the midwife there. And no point in my labor was I stressed or concerned or worried. And just having that wonderful calming presence of my midwife. And my husband was making jokes, and I was very privileged to be able to give birth in the Genesis Center before it closed. And it was like giving birth in a hotel, and there are facilities, like the beautiful birth on Fifth, creating this beautiful environment, when a woman is pregnant, she's not, that's why it's quite ironic that we all land up, in the hospital to have our babies, but we're not sick. And it's so important that, that a mom should be able to be in labor and be in an environment that doesn't say, you're sick, you need to be in a hospital.
There's something wrong. Yeah.
And so even if she is in a hospital, to take something from home, and just have that dim lighting, her favorite pillow, a photograph of her when she was absolutely happy that, all she can do is smile when she looks at this photograph. Just to have that calm, quiet environment where there aren't people marching in and out of the room. I've had poor moms that are literally like 8 centimeters getting ready to push, and the guy comes in asking them what they want for dinner tomorrow night. And that can add a whole hour onto their labor without them even realizing.
Yeah.
Yeah, so that ideal birthing situation where the body is just allowed to do its thing. And one of the things that I just remember about my midwives, it's, I literally birthed my children while their hands were on their hips, just gently coaching me, just watching and just saying, right, that's it. Okay, now pant, breathe, little pushes, now pant. Okay, now one big push, and then my babies were born. That to me is the ideal, is having that calm environment where there isn't that hustle and bustle of a hospital, where, the mother is in an environment where she feels completely safe, completely relaxed, and there is as little hands-on prodding and poking as possible, and that her labor, and that everyone in the room trusts in the labor process and trusts that the mother's body knows what's doing to get her baby out. And that to me, the fact that, and I remember, lying in the bath and the midwife's filling in all the paperwork, and she says, I hope the baby's not born in the next 10 minutes. And I said, why? Because I'm putting tomorrow's date on everything. It was 10 to 12. And I still, and joking, and, even with my third son, I didn't even know when my waters broke. That must have happened while I was in the bath. It was just, this incredible, natural process. And it's not to say
Relaxed and calm.
absolutely. And that's just, my message for mom is it's to trust, just to you trust in the process and trust in your body. That is really, and for everyone around you to trust, and
That's what I
make
was
sure
going to add on there, and make sure that everyone in the room also trusts them. Because
Make sure
it
your
can, like you said, it
partner
affects the energy. It changes the way that the whole thing feels when someone brings up a question, a doubt.
yes,
It's yours or someone else's. The energy changes.
absolutely. And that's, birth is such a mental and emotional thing as much as it is a physical thing. And to end with a story, I mean, I had a client. I mean, this was her sixth baby, so it wasn't that she felt like she didn't know what she was doing, that she needed a doula. It was just things, her doctor had broken her waters and contractions became quite hectic, and she just felt like she needed me. And she was 4 centimeters, and she felt like she still, she'd been there since 4 a.m. It was now 11 o'clock in the morning. 7 hours, it's a long time. And, she just felt like she needed that extra bit of support. And the minute I said to her, I said, don't worry, I'm on my way, her whole body just completely relaxed. That Danielle's coming. And 10 minutes later, her baby was born. Beat me to the hospital and everything. I got to the front desk and I said, I'm here for Mrs. So-and-so. And they said, no, she's already birthed. I said, not possible. Said, you've got her confused with someone else. And I walked into the room and there she was with her baby. And she just kept thanking me, even though I wasn't even physically there. She just kept thanking me because she said just knowing that I was coming just allowed her to just change that mindset from, oh my gosh, I'm in pain, I'm nervous, I'm worried, to, okay, Danielle's coming, everything's going to be okay. And then,
Her muscles just like, whoops, let's do this.
It's such a, I love telling the story, that, a doula can still do her job even if she's not in the room, It really, it's such a special thing. And it's amazing to be able to give that to our families, that they say, oh, the doula's on her way, and that when that door opens, and the doula walks into the room, it's just so wonderful to be able to create that calming energy in that space for women and their family.
Like I said, it's such a calling. It's such a calling for women to be a part of the birthing sphere. And I see it with every single person I speak to about it. And I can see it when I'm talking to you. I can see it in your whole energy. It's like you being summoned into this. It's absolutely beautiful. One thing we didn't discuss, and I know we've really almost hit an hour and we're kind of wrapping it up, but one thing I didn't discuss, and I think it's very prevalent, especially in South Africa with our birth rates and statistics, is what happens if someone is scheduled for a C-section, can they still use a doula? And then what happens if a natural birth kind of ends up going to a C-section? What does a doula do in those two situations? I think it's very big.
Yeah. If dealing with an emergency C-section, we're generally dealing with a mom who has tried to go through the labor process, but then a complication arises. So if the chances of her having a doula are higher. So she's, she may have, contacted a doula, tried for the natural, and then, there were complications, baby's not coping with labor, or mom's, baby's, changed positions. And so whatever the complication is, taking a doula into theatre is so beneficial. And I have attended some wonderful cesarean. And, obviously, an emergency C-section, the vibe in theatre is obviously very different to an elective C-section. But, I've never experienced, a crazy, C-section, where, baby was, where things were, absolutely, on the brink of anything. But, being in theatre, we can also just take pictures for you. There are some hospitals that don't allow doulas, or they only allow one person to go into theatre, and generally, obviously the dads will usually go into theatre with the mom. But I've been fortunate to go into theatre for a lot of Caesars, including a stillbirth. I was so trained as a perinatal bereavement doula. And that was also such a calling. It really is not for everyone. And but after having gone through what I went through with my first baby, having received a terminal diagnosis for my baby and having to go through labor and birth with that baby when I was in my second trimester, it really, this is, it's been such a thing for me to be able to also give that support to moms who are going through a miscarriage or are going into premature labor, or who have picked up no heartbeat in one of their scans. And so I was able to be with the family, while, their baby was born, and to just, make that experience as positive as it could have been, and to capture memories for that family. And also for, for my moms with happy, healthy babies, sometimes to have that person in the room. Often they'll send the dads out to put scraps on and everything, and they only let them back in once mom is ready to be cut open. And, I have literally held moms, through their spinal blocks, and I've had amazing bonding experiences with my clients through cesareans. I had a beautiful experience with a couple who were trying for a vaginal birth after cesarean, but then decided to go with another cesarean. She had bronchitis. The cord was wrapped so many times around the baby's neck, and, they didn't want to take the chance. And in theatre, they didn't put up a screen, and I told her everything that was happening because her poor husband just didn't want to look. So it was freaked out by the whole thing. And I just talked through everything. Can see baby, I can see baby's head. And I pushed her head up so that she could watch her baby emerge from her body. And,
So you can still support them in that
absolutely.
situation.
And to, and just
How beautiful.
to help the moms still be connected to their babies, even though they're not going through that labor process. So definitely, I know a couple who, the doula literally, it was a planned C-section. The doula stood there, took some photographs. They said, "Oh, it's the best money we've ever spent." Just to have that presence there, it really can make a difference in any situation. Really, it's
You know what? It really does. Because I had an induction at Genesis, which turned into a unplanned C-section. I had my doula, I had my midwife, I had my gynae. So I had the whole team in the room, the husband and stuff. And the doula can still add so much to the C-section. Cause it's a strange room. They're suddenly putting you in, you're getting needles. I didn't have an IV. I didn't have anything. And suddenly I had to get all these things done. Contractions were still happening, and having those people in the room. I don't know about elect, but, for the unplanned, having these people in the room, it was just okay, everything's fine. I can see their faces. I can't see anyone else's face. I don't know anyone else in the room, but these people are here. I'm okay. Baby's okay. I think it's a huge thing. It's the team that takes you from the beginning to the end, however it happens.
And Sharon has a beautiful, procedure that she would do, with her couples going for a planned Caesar, that, you still can get into the birthing pool, with your partner. And then dad can get into the birthing pool after baby's born with the baby and just do skin to skin with the baby in the beautiful birthing pool while mom is, recuperating a little bit. And then straight away skin to skin with mom. There's no reason why, mothers can't, still have all of those things. After a C-section, you can still, as I said, to even make the theater your own, and this is your birth. My birth philosophy, I know that's one of your first questions, is that it's your birth and your choice. And whichever way you birth, and obviously we don't argue if there's a medical complication and something needs to be done and an emergency Caesar needs to happen, then it needs to happen. But you can still have a say in your cesarean birth. You can say, would it be possible for us to, dim the lights in some way? Or could we put on some music? Can my baby, I want the pediatrician to check the baby on my chest instead of taking the baby away to a warming table, to check everything. Check the baby on my chest, delayed cord clamping. These are all things that you can still have a say in it. Just because you're now having a medical procedure does not mean that you are now removed from the equation. You are you are just the vessel for this baby that needs to be taken out. This is still your birth. So,
and I suppose having a doula helps you also plan ahead. Like see, okay, what would in option A, this is what I want. In scenario B, this is what I want. If this were to happen, can we try for A, B, C? And in that moment, you're there to help remind and encourage that these things are what you wanted. Because I think the father or the birth partner is also not really focusing on that in those situations and stuff like that. So it's another person to help make sure your wishes are honored as much as they can be.
Yes, absolutely. Obviously, all within range of having a healthy mommy and a healthy baby afterward. And that's the thing, when I create a birth plan with my clients, I remind them that it's more of a wish list. And, we wish that all of these wonderful things would happen. But if this doesn't go according to our initial plan, what would you prefer to be the next step? Would you prefer A or B? And if A was not an option and we had to go with B, how would you like to move from there?
So how can we make it work with
yes.
Yeah.
And
mental preparation for the eventuality, because also birth doesn't go according to plan. It's not like, oh my goodness, the water gushes out, the next thing you're screaming, the next thing. Like there's so many steps, there's so many things that are involved in it. And I think to have that mental preparation of what could go right and what are our options if things go slightly differently.
Yes, absolutely.
That's amazing. Well, Danielle, it's been so nice chatting to you about everything. It's been a very long chat, so I don't want to keep you forever.
I could book for hours and hours. I do antenatal classes, and generally I like my classes to be around 2 hours long. And I remember this one couple kicked me out after an hour. They said, "No, it's enough. We'll see you next week." I could just talk and talk and talk.
But that's amazing. You've been a wealth of knowledge and a really great insight into what doulas can be and what doulas can do for moms and for partners and for couples and for babies. So I really appreciate you coming on and chatting to me. I can't wait to get this out there and get everyone seeing and hearing all of these amazing things.
Amazing. Thank you so much, Ashleigh. I really enjoyed our chat today. Thank you. Thanks for having me.
It's an absolute pleasure.